very well that we have this large workforce need, and we need to make sure that we're creating dignified jobs as well as a lot more of them in order to meet SDG 6.2 and 6.3. So next slide, please, Abisola. So, oh, there we go. Yes. So the objectives of our session today is really to dig into this research agenda. I think you would have heard in all of these sessions, talk about the kind of knowledge gaps we have on the number of workers, the kinds of health issues they face, what are their working conditions and how can we make them better in terms of financing, technology, tools, laws, policies, reducing stigma. There's a huge amount. So our objective today is to understand these issues a little bit better, identify some of the key research needs, and that has been done to a certain extent with a survey that was done 2 months ago. And today we're really going to focus on ranking and prioritizing those research needs. And we want to work with you to know some more about the opportunities to advance this research agenda. Next slide. So here's how things are going to go. This is the overview of me, Kate Medlicott, describing that. Then my colleague Abisola Osinuga is going to give a summary of the research methods. We're going to spend a little bit of time trying to draw out some additional research questions you may have. But the major part of this exercise is going to be a very interactive session asking you to rank some of the research ideas that have been pulled out so far that will become into a publication of a research agenda on sanitation workers. So that's our session, and with that I would like to pass over to Abisola.
Thank you so much, Kate. Hello everyone, I am Abisola Osinuga. I'm a research scientist focused on health equity issues, especially gender health equity issues, and also workforce health equity issues. I have a background in occupational and environmental health, and I feel so blessed to be involved in this work on improving sanitation work through identifying research priorities. So the overarching aim of this process is to use standardized methods to identify the top research priorities. We all know from literature and from even being involved in this work that there are so many knowledge gaps concerning sanitation workers' health. And the WHO, alongside other partners in the Initiative for Sanitation Workers, decided to use this process in order to gather evidence from all
collecter des informations, des preuves
global level on issues affecting sanitation work. And we are using a standardized guidance that has been developed by the WHO, as you can see on the pictures attached here. And basically the overview of what we did was we had a planning session where we defined the objectives, the context, where we wanted to focus on. We also created an advisory group, bringing different people, experts, and sanitation workers, representatives and associations from different parts of the world. And then we implemented the survey, as Kate said, and now we are in the process of ranking the research priorities already elicited. So we are using, I'm going to go to the next slide. So the research objective, as I said, is to provide a framework and institutional guidance necessary for mapping and conducting research activities involving sanitation work and sanitation workers. And the effect is to, make sure, because there's so many competing priorities and there's just so much we can do. So we want to make sure that investment options are targeted to the most prioritized, most needed and pending research areas to improve the health and working conditions of sanitation workers. And we are engaging decision makers and stakeholders, a consensus-based process, and we're making sure that we are including the elements of equity, diversity, and inclusion, making sure that the process is representative of what sanitation workers feel represents their research priorities. And then we also want to use this process to raise awareness on the health risk and including other challenges faced by sanitation workers. So what we've done so far is that part of planning and defining the objective and scope is first, what exactly has been done in the literature in terms of sanitation work. And we went through all the papers, all the literature that looked at sanitation work and tried to categorize how they describe knowledge gaps facing sanitation workers. And that's what you see here. And some of that, I don't know if you're familiar with it, there's a report published by the WHO. It's called Health, Dignity and Safety of Sanitation Work. Some of these research gaps were also highlighted in these published reports. So as you can see here, technological innovation, occupational health and safety issues were the most common issues highlighted in the literature. And also there's also the aspect of, apart from doing these knowledge gaps literature, we've also conducted a systematic review to look at the health dimension. What are the most common health issues and health risk facing sanitation workers? Now I'm going to go to the methodology. After we've done that, the method we used, we checked, because there are different research priority exercise and it's being used in different fields, not even only health-based fields. So we went around and thought, what can we use that will be representative or can be easily adaptable to sanitation work? And we found that these are the common ways by which research priorities are undertaken, the common methods used to set research priorities. And as you can see in these pie charts here, the most common ones that are standardized and they've been validated, they can be easily reproducible and reproducible are the Child Health and Nutrition Research Initiative, the James Lind Alliance Priority Settings, and Essential National Health Research. Then we looked again at studies that have kind of compared the pros and cons between each of the methods. And we found that the Child Health Nutrition Initiative was the one that had the best, was the most option. It was more representative. We could easily score it and it was reputable compared to other options. And it's also consensus and metric based, which is a very good advantage compared to the others. So the Child Health, as I said before, the Child Health Nutrition Research Initiative has been used in multiple fields. It's a consultative process that involves identifying, compiling, and listing competing research questions, and then evaluating the set questions against a predefined criteria. Some of these predefined criteria are things that makes common sense, like how answerable is this research option? Some research options are answerable, even though they are nice, they are not feasible. So how feasible and answerable is it? Can it be easily translated to multiple contexts and multiple groups? That's translation. Then effectiveness, how will it truly generate effective interventions? The maximum potential to reduce larger proportions of disease burden or solve multiple problems. And then equity, which is from what we've been listening to in this forum, equity is one issue that keeps resonating at each point relating to sanitation work. Equity in terms of gender, caste, and other marginalized issues facing sanitation work. So the first thing we did was basically following the Child Health Nutrition Research Initiative was also very close to what we have, what we've already itemized, and it helps us do that easily by, helping us identify and involve key stakeholders. We reach out to people that we feel would be able to inform this work. And we also disseminated some of what we've done at the UNC Water and Health Institute, and we're also doing that here too. Then we define the context and criteria. All sanitation workers, regardless of the typology of work. Then we solicited research ideas via survey using some of the guidelines, we adapted it because the one disadvantage of the CHNR is that it's not all applicable. It's very health-based, so we wanted to make sure that we are looking at it from an holistic lens. So we adapted it to suit our context. And then now we've developed the ranking survey based on ideas we've already solicited from experts and stakeholders. And now we want to use this avenue to rank and score some of the survey and also collect or solicit some research ideas that we may not be thinking about that are important. Sorry. So here is, pardon the big table. I just wanted to show what we've done in terms of the way we categorize the research ideas. So we use this 4Ds, it's called 4Ds framework of the CHNR. Here, it's like a research instrument method to categorize some of the research themes and research ideas. So the what we thought about is how is the sanitation workers problem described in terms of description? What do we need to know about the risks and challenges facing sanitation workers? So those are the kind of research questions that will help us answer this. Then development is like perspectives focused on understanding and improving the utility of current approaches already employed. And then delivery in terms of like effectiveness. How do we improve the scale, acceptability, affordability of interventions? What do we need to find out more, better and faster to improve conditions for sanitation work? And then discovery is all about innovation, right? There are so many innovations happening, but there's not much avenue to scale them up and highlight them. So what are these current innovations that we need to highlight in order to generate new knowledge and interventions to improve the lives of sanitation workers? And then the research teams under each of these description, each of these instruments is already highlighted. And that was how we categorize this also in our survey. As under the research idea or question solicited, we listed some of the examples of research ideas, which will also help us score here.
I'm so sorry to interrupt, but our interpreters are asking you to slow down a little bit just so they can keep up with the live interpretation.
Okay, thank you so much. I'm so sorry I didn't see that on time. Thank you.
No problem.
While we have an interruption, Abisola, I forgot to say at the top that we're going into these interactive sessions now. So if you're watching this, watching the recording of this later, then you can skip to the end of the session and find the links for and QR codes to complete the ranking exercise and survey. Over to you again, Abisola.
Thank you, Kate. So now I'm going to share my screen and show the link to the Google Jamboard. Please let us know in the chat if you're having trouble accessing or understanding how to use this Jamboard session. And we want you to use this session as a way to, include some of the thoughts or as it's coming to your head, what you've learned from this forum on research ideas that are important to sanitation work. And we are doing this because we want to make sure that we are capturing every perspective that we should capture. And then there's a link to the survey, the first survey. Please include, if you can make the time, we would really appreciate if you could also include some of these research ideas and questions you have in this survey. So now I'm going to share my screen and show the Google Jamboard just to see what we are all doing. Can you all see my screen? Hope so.
Yes.
Okay. So we can use the sticky notes. For example, if you click on the sticky notes and just type just something, I just put and then you can just drag it here. Don't worry about space. You could stack it on top of one another.
Just checking that everybody has found the link to the Jamboard in the chat box.
So I will leave
seems like
3 more minutes for that while we think about, okay, I'm going to also help us by prompting description, like some of the research teams that we found, other work that is politically engaged, nice. So I would say this is like more into the development perspective, because development has to do with policies or guidelines or systemic research and improving legal or social protection, professionalization of labor, improving partnerships among allies and those involved in sanitation work, amongst others. So the reason, I know some people may be thinking, why do you need us to solicit more ideas when you already have research things? We just felt that it would be, because it's not like we are going blind. We kind of know what we need to do, right, for sanitation work, but we need to make it very standardized and going to the prioritizing and making sure that each of these research ideas is actually actionable. And that's why under each research team, we really appreciate you giving us some research ideas on that. The economic value of the health risks to sanitation workers, nice. So it can be included in global, sorry, I don't know the full meaning of CBA, advocating for investment and funding, legislation work on labor rights, I think this should be here. Perspectives that encompasses, nice. Yeah, I've been hearing some of these intergenerational effects. I had that at the forum I attended last week, yesterday, I mean, so nice. So I will give us 2 more minutes, and you can always go back later to add anything to it, but I'll give us 2 more minutes. And if anyone has any discussion question or something, we can talk about that. Just if you have something you want to share before we move on. And the survey is translated to French and Spanish. So you can include your ideas in the survey. Thank you all. I'm going to go back to the session.
Looks like there's lots still coming. So
yeah,
we can keep it open for a little while.
Okay. So we can keep going. We are going to be on the Jamboard to the rest of this exercise. So you can keep being on the first slide. So now we want to go to the interactive ranking exercises, right? And what we want you to help us do is that we've already collated some of these research ideas from folks like you that also submitted research ideas to us. So we want you to help us rank it based on these criteria, predefined criteria from the CHNRI that I explained before: how answerable and feasible, potential for translation, how effective, how equitable, maximum potential for impact, and sustainability, how sustainable. So I put this picture here just to show that we would appreciate you just, because the space is so tiny, so we won't have a lot of space to put in sticky notes. So we could just click on this circle and place it wherever we want to be. If it's a yes, if it's a no, if it's that you do not know, you do not know whether you should, it's not like you don't understand the question, you understand the question, but you do not know whether it's a yes or a no, and they're not applicable to me. It's like you don't even understand this research idea at all. So I'm going to go back now to the Jamboard. It's still the same Jam session to continue from where I stopped. Does anyone have any comments or questions, chip in? No, so going back to the Jamboard. Wow, this is really beautiful and colorful. I feel that we should, I'm going to highlight some of the ones that I can read. So someone says, the economic value of the health risks to sanitation workers, so it can be included in global cost-benefit analysis, advocating for investment and funding. This is a really nice research idea, because I also saw from some of the research ideas we collected, people were really interested in trying to understand income insecurity. We know that there's income insecurity amongst other issues, but how does this influence lived experience, social relationships, how the work is seen, the visibility of the work, and stigmatization. So some people already also talked about that, so it's nice to see. So discovery, mass production, sales and distribution channels, and after sales service of emptying technologies, widely acceptable and affordable to workers. Nice. So now I'm going to go to the next, to this jam session. Nice. Okay, we are innovative and we've come up with different ways to fill in the jam. Thank you, folks. It doesn't have to be a circle. I appreciate those that were ingenious and put in their crosses. So the first one is establish comprehensive and standard classification systems for sanitation worker subtypes, formal versus informal, or public-private. I'm very confused, even I am very confused on how to group sanitation workers. How do we classify them? That's basically what this question is saying. And also to understand gender perspectives of sanitation work, especially along the value chain, from manual MTRs to everyone involved in sanitation work, to really understand and comprehensively assess the participation of women. Yeah. So I'm going to, does anyone have any, you can include in the chat, yeah, I really like that. That's just what I wanted to say. Okay, wow, nice. For gender perspectives, it's important to consider both paid and unpaid work. I really like that, because my research dissertation was focused on domestic work, unpaid domestic work among women. So it's in Nigeria. So I really like that, like just trying to understand the intersectionality between all forms of unpaid work, which could also, of course, sanitation work, especially for women, is unpaid work in homes. Maybe I should give Kate or some other panelists opportunity to talk before I wear you guys out with my voice. Does anyone have anything to chip in?
I have nothing particular to add at this time, but hopefully you all understand the exercise well. It seems clear based on the results that are coming in, and there's 19 of us here, and all of you are panelists. So if others would like to comment, feel free to open your mic. Otherwise, I think we need to move through the questions. Maybe.
Yeah. Thanks, Kate.
All 10.
Mm-hmm. So the second research question: how can we establish? Oh, sorry, that was repeated. This one: how can we develop systematic and transparent ways to document and report work-related injuries, accidents, and deaths at the national, local, and global level? So we all know that there are lots of risks to sanitation work. So what is this? How how important or how much more should we prioritize these research questions on trying to develop systematic and transparent ways to document and report work-related injuries, accidents, and deaths? You can also include sticky notes if there are other similar research ideas to this that you would like to highlight. And if you're joining us on your phone, you can also use that. Does anyone want to chime in or not? Okay. Please, you can use the chat to include comments if you rather do that than use the Jamboard. Now I'm going to go to the next questions, still under description. Now to the theme that has to do with identifying and addressing the social and behavioral challenges affecting economic livelihood, social and legal protection, and the marginalization of sanitation workers. This is a lot. Slide 3. Sorry, I'm going back based on the chat. Someone said in the chat. So I think, oh yeah, we missed slide 3. I thought it was the same as, for some reason, yeah, I missed that. Okay. I will stay here and then go back to slide 5. I missed this. So now under description, quantifying and profiling the global national sanitation worker. Thank you for pointing that out. We want to, what this research question deals with, how can we establish a comprehensive and standardized classification and understand the participation and gender-specific work roles along the sanitation value chain. I think we had addressed this before, and that's why I missed it. We've addressed it. Back to slide 5, description, identifying and addressing social and behavioral challenges. These research questions involves recognizing and improving understanding of the roles of worker unions, which in Sanitation Workers Association, among other sanitation worker unions, cooperatives, and other associations in improving legal and social protection. So, and please use the sticky notes to also include any other research ideas relating to using worker unions to improve legal and social protection, or maybe partnerships with worker unions. That's slide 5. Thank you for your comments. Very feasible, I like that. Easy to interview cooperatives and associations to map the roles of this structure and network. This type of research is highly qualitative and context specific, but really important in my view. Nice. For the person that says the type of research is highly qualitative and context specific, you could also include, if you have ideas on strategies that can help translate this research idea or implement this research idea, please include that too. Must also focus, yes, must also focus on those left out or who opt out from such organizations.
Ceux qui sont laissés sur le...
I don't really have much experience in working with sanitation workers, but I really appreciate someone that does that kind of work to chime in, maybe in chats, based on your experience, how we can implement this idea. So I'll move to the next frame if there's no one chiming in on that. Description, so identifying under the same social and behavioral challenges, because there are lots of social and behavioral challenges. Research on the impact of stigmatization. We know that there's stigmatization, but we want to understand or quantify how this affects social relationships, social capital, even adoption of risky behaviors, like risky, unsafe behaviors on part of sanitation workers, including coping strategy adopted to deal with stigmatization. So, do you think it's answerable and feasible? Is there potential for translation? Do you think it should be broken down to 2 or 3 research questions? Because I think so too. But yeah. Could the interpreter interpret the chat for me? Someone just wrote some.
That's just me. Sorry, just to say to any French-speaking attendees that they can join. Just to say that the Jamboard's live. Only me.
Okay, thank you. I wish I had interpreted the Jamboard, but the same questions are in the survey and they're interpreted to French and Spanish. Next, now the last part really relating to describing the problem and challenges and like evaluating. We know that some interventions have happened, right? But we want to know what's the efficacy, coverage, and effectiveness of this behavioral or technical intervention to reduce risk or sanitation or improve sanitation work. So how do we better understand and be sensitive to how sanitation workers perceive risk and how they want this risk to be addressed? Throughout the research ideas, 3 or 4 people highlighted the need for participatory action research. So that's why this is, how feasible is it to utilize a participatory action research framework to better, to work with sanitation workers to understand how they perceive their risk. And we are all promoted to panelists now because this is a very interactive section. So please don't hesitate to chime in if you have anything you want to say. And let's also use our sticky notes as needed. Okay, so the next, some reason this was repeated. Okay. 8 was repeated. So this next one is using technologies that increases emptying. Now we are going to delivery of interventions. And delivery has to do with how do we improve, the efficacy, coverage, improve the affordability and accessibility of existing interventions, right? So, so one of the research ideas that was gotten was that we should use technology that increase emptying speed and reduces fuel costs, including dewatering and decentralized treatments. So do you think this is a priority in terms of improving the scale? For this question is more focused on technological intervention. Do you think it's a priority? And based on the ranking criteria, how would you rank this? Also, please use the Jamboard as needed. I'm going to delete the duplicates so it doesn't confuse people. Various large characteristics limit the generalizability of this type of technological research. I'm not involved in this kind of research, so I really appreciate if someone that is much more conversant with treatment technology interventions could chime in. Okay. Someone else said it looks more feasible while working with MPT Association. I think so. I think it's very focused on emptying mechanical and manual details. It reduces cost. Okay, nice one. So I'm going to move to the next slide. You can keep going there on that if you still have more things to put. Improving the delivery, translation, and scale up of existing health safety and behavior. So the last part we talked about affordability, right? Cost, saving costs. And because if you save costs, you'll be able to scale up the intervention. So this research question says we should better understand the needs, priorities, and working realities of sanitation workers and build this into the design of any occupational health and safety equipment, such as PPEs, for example. The research idea also says it's important to consider gender, weather, and other factors that could affect the use of PPEs when designing PPEs. Yeah, someone also chimed in and said it's very critical. This research question is very critical to potential behavioral change and use of PPEs. This will make me wonder to what extent will using PPEs reduce the risk. I wonder if, I know that it, like it's been said that of course as an administrative control is really good, but to what extent is this sustainable in reducing the hazardous risk of the work. Product design schools. Wow. I wonder if the product design schools, I wish the person that said that could give us more details. I'm going to move on. We are almost done. So, and we'll have some time for just regular forum discussion, if you please. Now to discovery, generating new knowledge to develop practical or scalable interventions, guidelines and policies for sanitation workers. So this research question says that we should collect, we should create a systematic way of collecting longitudinal data. That means like repeated measures data periodically, and use multi-country research to understand priorities for sanitation workers. Same thing using participation action research. Do you think it's feasible, especially thinking the fact that sanitation work is very local, context specific, from local to national to global level? Do you think it's possible, maybe working with allies like maybe NGOs, ILOs, to integrate probably a global burden study or something that iteratively collects longitudinal data on sanitation work issues? Okay. Schools of industry are focused on people-centric designs. Thank you, Jen. Someone also said that we should include historical archival data to understand the changes to sanitary systems and work associated with shifting infrastructure over time. Yes, this is a very important, especially relating to urban sanitation infrastructure. Irrespective of where we are all over the world, there's decaying infrastructure, and there's just need to understand those changes as it occurs over time. I like the smiley. I'm going to, recognizing the local cultural context within this will be important. CAST, for example, is a very particular South Asian construct. True. So I'm going to move on to the next slide. Discovery still, new knowledge that leads to developing sustainable interventions to improve sanitation workers' health, safety, and dignity. So one of the research ideas we collected is that someone said we have some promising technologies, but many that are not working at scale for us to but not many are working at scale for hard to access sanitation facilities. So how do we understand the barriers to scale for those technologies? So that's what the person is saying, that we have many things going on grapevine, but scaling of this intervention, especially for hard to access sanitation facilities, is hard. So understanding the barriers to scale for those kind of technologies would be useful. So ranking by feasible, potential for translation, effective, equitable, impact, and sustainable. How would you rank this research idea? And if you have any question that you think would improve the wording of the research idea or improve the meaning, please. Okay, I like what this person said. This is, the obsession with technologies is fascinating. Case in point, reinvent the toilet. Why not stick to what works on ground and improve it? Like between leach pits. I quite agree with that. Sometimes we spend a lot of money on like technological innovations that are not sustainable and they are not locally adaptable. So good points. And in the survey, we also included a comment section for you to include other research ideas that you think are important but were not highlighted. Would appreciate you including your ideas on that in the survey. I think we have one more and then we'll be done. Okay, I think I'm even done. Yeah, these are just extras. So I'll go back to that last slide and give people 1 more minute. Instead of new technologies, work on the strengths of local markets and spare parts to maintain and operate the existing technology. Sure. I think some barriers are well known. Cost. Perhaps this would be well implemented via participatory action research. Barriers, okay. Feminist as a barrier. Thank you for such thoughtful comments. Now, I want us to just talk iteratively. We can all keep going at the Jamboard, include comments in other slides as we go along, as the session continues. I'm going to stop sharing my screen and give Kate, go back to the, I think I'll just go back to this, the PowerPoint and give Kate time to close. We've done this. So these are the links. The links are within the PowerPoint, and please take your time to, I think the PowerPoint is on the agenda, and the link is also going to be placed in the chat to fill the survey. Kate, over to you.
Yeah, thank you, Abisola. Actually, I think we have a little bit more time and a kind of a nice size group, actually. So I wondered a couple of things. Firstly, just take your time to go back to those first slides. If you've been stimulated by this conversation, you have some things that you think are really important research priorities, please add them there, and we will try to incorporate them into the overall research agenda question. We've just looked at 10 questions to be ranked here today, but at the current count, we have over 45. So there's there that need ranking. And the QR code links are there for you to follow up on. You might be wondering about the next steps. So once we've completed this ranking exercise, we want to move towards publishing a research agenda. And, you know, research agendas can be quite powerful things, or they can sit in a drawer or an academic literature. Our ambition for this would be that, you know, these most important questions are really given a platform, and that through a published research agenda, we can drive investment and interest towards those specific research priorities. So I think it is quite a important exercise if we do it well and make it well publicized. So I would just really encourage your participation, but also perhaps just take a moment now, if any of you would like to comment, give us some feedback or some thoughts you're having about, you know, how we can you know, get towards the published research agenda and to make that most impactful in the sanitation community. Actually, not only the sanitation community, I think we also need to be making sure that it's visible within the labour community. So with that, and hopefully while you're continuing to add to the Jamboard, could I invite any of you who would like to comment or ask a question of us to please open your mic and do so.